Right. Cold hands, though, aren't some, if you've always had cold hands since you were a little kid, you could probably find some pattern to your day, to your cycle, to your emotion, to your activity level. You know, I have times where my hands are burning up, and there's many reasons why I have cold hands. You have to, there are things to ask. If you have significantly cold hands or feet or things, you tell your doctor about it. One could be thyroid. You always check your thyroid, and their doctor does that with heart disease because it makes a big difference with your rate and some other things. It's a metabolizing fuel, the thyroid. So oftentimes cold hands, depending on how and when, I would have to take your history, are often not too big a deal. But
just answer my question. My husband's cold hands, and he was given a new thyroid medication because the thyroid medication he's taking was, I guess, not right. So that's probably wasn't his.
yeah, making it worse. And some people, like my daughter, and there are other types of vascular diseases, Raynaud's, and things where people constrict their vessels, and those are significant diseases that aren't directly cardiac, they're vessel diseases. So it depends how severe it is. If it's debilitating, you're just someone that, that's the way you deal with your nervousness, for example. Some people get sweaty hands and warm hands, and some people don't, But it's not something to completely ignore. But in general, I wouldn't worry too much if you had it your whole life. You know what I mean? Now, if you have sudden onset cold or my hands are sweaty, that's different. Anything that's a sudden onset that you didn't have before. Those are good questions to ask your doc because he knows your history. Yes?
Tingling and falling asleep, are those same
Yeah.
things?
No, they're not. But that's a good, I know what you're saying. You're smiling because there's no other way to, it is true. This is the thing about trying to answer things completely. Nerve, artery, and veins run together in bundles. All right, so if you have a significant issue, one person over here might say, well, that's not true, because in my case, I had a vein problem and the nerve was bad too, or the lymphatics, which run with it. They're next to each other. So certainly when things are next to each other, they can affect each other. But tingling, numbing, it depends on when, where, and how. Almost always, it's nerve, right? That's what gives you tingling, right? Period. And that nervous sensation is usually interrupted by compression. So as we lose muscle mass, too, we also have more nerve compression because we sit on nerves, we lean on nerves, right? Or we sleep on nerves. And so I have to ask your history and where the nerve is, because nerves are like a wire to a light bulb. It's either the light bulb, it's either the wire, or it's the switch. That's it, right? So I would have to ask you, and then I would have to analyze that route. First things first, nerve first. If you're diabetic, that's different. Peripheral neuropathies, it's still nerve. Is it both sides? Is it one side? All those questions, doctor questions, they are. Now, I know many patients that are smarter than me. So I'm not saying, or if not all of you, it's just about education. So talk to your doctor. Don't underestimate your capacity to understand a medication, but always address it with humility because it is complicated. And as soon as you think you understand something, that change becomes harder. If you're certain that you know it, then you don't change as easily when it's modified. And a lot of times explanations, when it comes to health, modify over time. The explanation changes. So try to understand your disease. That's what we want to do over 2 sessions. You're probably going to leave with no specific knowledge. What did I do there for 45 minutes? Did you think about it? But what I want is maybe in the back of your mind, there's a question about your health that comes up. Even if you don't think it's related, you're not sure about tingling, you're not sure about cold hands, whatever, ask.